Okay. I think we are now live on Facebook. We are so excited to have two preceptors with us. One, Dr. Goodman, who's from New York City, one, Dr. Lin, who's out in Boston. Both are kind of en route, so they're on cell phones. But let me see if we could figure out how we can get both Dr. Lin's and Dr. Goodman's photo. Like, you can't see them here in the virtual world, but they are they are with us. We
We are
promise.
here. We are here, live and in person.
Exact.
Yes. Yes.
Exactly. So before we hop in, let me welcome Antoine to our table, if you will. Antoine, tell us a little bit about who you are and what you do.
Yeah, of course. Hello, everybody. My name is Antoine. I'm an advisor at AMO. I've been here for about a year and a half, and I'm probably one of the first people that you will speak with if you are coming looking for a clinical rotation. My job really is to help you find a rotation that's going to work for you, whether that rotation will be with one of the doctors we have here today, with Dr. Lin or Dr. Goodman, or if it's with another physician that we have available. I'm really just here to make sure that you are able to speak with me and figure out what's going to be best for you.
Awesome. My name is Danielle Isea, and I am the senior. What do I do at AMO? I'm the senior marketing manager. Essentially, what I do is I'm the lead evangelist for AMO. I love making sure people know that U.S. clinical experiences are alive and well, available to everyone around the world. We need uh, IMGs. We need your input. We need you to come and teach us what you know, and we love to share the knowledge that we have. So whether it's virtual, because it's hard to travel, visa restrictions, COVID, all that good stuff, or whether it's in person, we have so many options for you to choose from. So, Dr. Goodman, if we could start with you, and if you could tell us a little bit about your practice out in the Big Apple, New York City.
Sure. So my name's Elliot Goodman. I am a general surgeon. For many years, I concentrated on bariatric or weight loss surgery, but of late, concentrated on other aspects of gastrointestinal surgery, elective surgery, emergency surgery. Um, I am on the faculty of the Mount Sinai School of Medicine, and I'm the clerkship director for the general surgery elective and clerkship at Mount Sinai Beth Israel, which is in downtown Manhattan, and at Mount Sinai Brooklyn, which shockingly is in Brooklyn. Um,
Very
and
cool.
I'm also a visiting professor at a couple of medical schools in Israel and one in Europe. So for many years pre-COVID, we had a pretty busy regular type elective in general surgery where students from all over the world, not only just from the United States, would come into Manhattan and Brooklyn and spend time with us. And obviously, I guess March of last year, because of COVID, we shut that down. And unfortunately, in spite of things beginning to recover, but based on certain guidelines put out by the medical school by AAMC, come, I guess, next week, come July, domestic medical students from outside of Mount Sinai are able to come back into the hospital, albeit at sort of a 50% capacity. But medical students from outside the United States are still essentially barred from coming into the hospital. So for the last, let me think, 10 months, I've had a virtual elective. We've had students from literally all over the world. I think 1 month we had to deal with time zone differences of 14 hours between Korea, Japan, and California. We can talk a little bit about the logistics of dealing with time zone differences, but we've had a pretty busy virtual elective, and it will continue, and it will continue even, I think for quite some time to cater for international students and graduates. And it's a rich experience. It's a lot of fun. I enjoy it. I think the students enjoy it. If they do well, they get a good letter of recommendation. And I'm happy to answer any questions that anybody has in regards to general surgery electives established electively. So that's my two-minute elevator pitch.
Awesome. And we're going to dig into that in just a little bit. That piece that you mentioned about how these experiences, they aren't going anywhere. They are so necessary, especially for those planning to apply for the 2022 match. So thank you, Dr. Goodman. And Dr. Sam Lin over in Boston. Tell us a little bit about what you do and how you're connected to AM opportunities.
Sure. Hi, everyone. And my name is Sam Lin. I'm a plastic surgeon in the Boston area and affiliated with Beth Israel Deaconess Medical Center and Harvard Medical School. We have a residency program. I have a virtual clerkship that also has been going on for the last almost a year or so that really developed because of the pandemic. And I think it's just been a great experience to be able to do this in a virtual manner, just because it's from a lot of benefits. Certainly, it saves the students a lot of time, effort, and cost in terms of travel, but also the fact that I'm spending a lot more time with folks that I wouldn't have been able to do in an in-person rotation. As Dr. Goodman just said, it's been still slow to have in-person rotations again. Who knows when that'll be? But I think this is a really great opportunity to really get to know someone, and I find it to be pretty enjoyable to meet new students really every month and interact with them from all over the world. The hardest thing is, as Dr. Goodman was saying, has indeed been the time zones and finding a equitable or common time for everyone to be able to join. So I know people every month are either staying up really late or waking up super early. But so I thank them for their efforts for sure. But it's been a great experience overall.
Very cool. Thank you. So, Antoine, before we go any further, for those that are wondering, okay, what is a virtual clinical experience? Can you tell us a little bit about the two options that we offer here at AMO?
Yeah, definitely. So for the virtual rotations, we have two primary ones. We have ones that are patient focused, and then some that are a bit more education focused. So for the education focused, obviously it's going to be a bit more focused on delving into research. You'll be able to do presentations, interact, and do something that's a little bit more akin to academia. But then we also have the patient first rotations, and those are going to be the ones that are more or less just like the in-person rotations you would have. You will be able to directly interact with the patients. You would need to have malpractice insurance to protect yourself because you will be engaging in that manner. And it's a lot of fun. Definitely a good experience no matter which one you do. You are able to earn a letter of recommendation from both. So whichever one you're interested in, definitely let us know throughout this presentation. If you have any questions, whether you're watching in the Zoom or on Facebook, please leave those in the comments. If you have questions after the rotation about how to go through with the process, feel free to email the advisors at advisors@amopportunities.org. If you're in Zoom, there's also a link that you can use to schedule a call. But if you do email us at advisors, we will also reach out with a link so that you can schedule a call as well.
Very cool. Okay, so Dr. Lin, question for you. With COVID-19, the emergence of telehealth was catapulted forward probably 10, 15 years. More than, we were getting there, but COVID-19 just ushered it in a lot more quickly. So, as kind of the medical delivery model has changed a bit for many doctors and patients, should medical training change too?
Well, I think for sure telehealth and virtual visits and education and follow-up have rapidly become a lot more accepted. And I, for one, have really actually embraced it and now have made it a complete part of practice. So, I mean, the biggest thing before all this was the fact, and this is maybe another topic, was the fact that all of our physician calls to patients that we did all the time certainly weren't being compensated at all. We were just doing it all in our own time and out of the, just for patient care and information and the necessity to do that. But now I think insurance companies have clearly realized the value of telehealth, both from a phone call and also a virtual visit. So it's really here to stay. And we've definitely incorporated it into our practice, and we'll continue to use it in the future.
Thank you. And Dr. Goodman, do virtual experiences in your experience, do they train students in a way that in-person experiences don't?
I think that you can sort of curate an experience online that is difficult to reproduce in person to a great degree. So if you just rely upon the sort of teaching material that's in the hospital or in the clinic at any one particular time or during the course of 1 month, then you often find that you see way more, or that the students see way more than they need to of certain, obviously very common conditions like hernias, if you're doing general surgery, hernias, gallbladders, patients with appendicitis. And so, they probably see 5 times as much of that as they need to, but they don't see perhaps slightly more interesting or more uncommon conditions. However, if we create a virtual experience for them, such as using online video platforms where we take the students through a variety of operations, watch them online, dissect how you do the operation, then there are certain advantages. Number one is you can obviously collect a whole bunch of operations that they wouldn't necessarily see during 1 month's worth of whatever comes in through the door, as it were. The other thing is, if you actually look at any particular operation, the essence, the important teaching points of any particular operation represent probably only 10 or 20% of the actual operation. So by looking at curated, sort of edited online videos of surgery, you can show them what they need to know, and they don't have to sort of sit through all of the irrelevant, sort of non-teaching moments. So I think that you can actually condense what they need to learn into a relatively short period of time, and by the end of the 4 weeks or so, everything will add up to a very rich and broad experience. So there are distinct advantages.
That is so helpful.
Yeah,
Dr.
I
Lin?
would definitely second that. With all these edited material, that everything's very available with videos. You can really get down and cut to the chase of what's really important. So I completely agree with that.
Thank you. And for those who are joining us on Facebook or here in Zoom, if you have any questions, feel free to leave those in the comments, and Antoine will get to them lightning quick. One thing that one of our past visitors noted, he was like, during this virtual experience, there were terms, because some of it was learning medical English terms. And so he was like, there's terms that were used, I just didn't know what they were. And so it was so helpful. You have your kind of dual screen set up. You have your preceptor on one screen and what's happening there. And then you have another screen where you can type in these phrases that you're just not sure of what's happening, and then be able to kind of put together really thoughtful questions that you can ask, kind of after you've seen a patient or a procedure or something like that. And then one other benefit that a previous student mentioned was being able to kind of go with a preceptor or an attending physician to different sites. Sometimes you have a procedure here, a procedure there, and if you're in person, it's hard to kind of have a person tag along with you. But if you're virtual, it's easier to say, hey, we'll get to you on the iPhone in just a little bit. So many advantages to virtual experiences. Last question in this section before we go on to launching virtual experiences. And Dr. Lin, if you can, if actually both of you, if you can answer this, but Dr. Lin first, what will the educational impact be to those students, graduates, IMGs who do not have virtual experiences, and how will that impact their competencies?
You're saying who don't have any experience at all, virtual or in person?
I would say virtually. Just the kind of the website manner, the technical aspects, the telehealth
Sure.
pieces.
Yeah,
What would they be
I
like?
would say, like I was alluding to before, um, at least with me, I have a, I think everyone's rotation is structured a little bit differently. For me, I end up spending some dedicated time each day, and that time it would never happen in an in-person rotation. Like at the end of every with rotations, as we know with work, we're just all working together to finish the work to get home, and so to then be spending another hour or so at the end of each day, I think I would hear about it at home. So it would not happen. So this is really a great way of being able to schedule it. Certainly on my own time, after everything, and really taking time to interact with the students. That is a big thing that I think would be not the same actually in an in-person thing. I mean, there's pluses and minuses to both, of course. And an in-person rotation, you clearly understand, I think, how a service works or the culture of the place, understanding how nuanced interactions are, which you don't get on virtual, of course. But from a mentorship, preceptorship sort of model, I think that the virtual really affords a really a great one-on-one interaction with your preceptor.
Thank you. Dr. Goodman, anything to add there?
Yeah, I'd say a couple of things. I think that number one, based on what I was saying, that at least for a lot of medical schools, they're not allowing in international graduates or students. This opportunity to make connections within the U.S. postgraduate sort of training universe is an international student or international graduate toe in the door. It's so difficult, and I say this as a foreigner. I mean, I've been here decades, but I still came in from the cold in the pre-internet era, where I came into the into the United States from the United Kingdom, really knowing very little about how it works. So it's very important to get that first little introductory connection, and this is a good way of making connections with U.S. physicians. I'm a clerkship director. I sit on the residency application committee, so I know how the system works. And students who connect with me virtually, and if they do a good job, then that's a connection that they can then sort of take to the bank in terms of getting a good letter of recommendation, and if I think appropriate, me making some phone calls to program directors I know when it comes to residency. The other thing I would say is that so many of our weekly and monthly conferences have gone online and will continue to go online even after COVID hopefully is pretty much beaten down once and for all. Knowing how to present oneself and present cases, arguments, etc., online, I think will be a very useful technical skill to develop, because when students become residents, this is how they are going to have to present a lot of times, and knowing how to do things on a remote platform, I think will be a good tool, for the rest of their professional career.
So you've heard it here, folks. Virtual experiences, they're not going anywhere. Hugely valuable. Thank you for your insights. So if now we can get to the launching a virtual experience. So we know there's lots of hesitancy around anything that's new. That's just kind of a human default, if you will. So with this emergence, the new technology, it makes healthcare very accessible to many more individuals, but it's also slightly terrifying to those who aren't technology adjacent, if you will. So, what are some roadblocks, Dr. Lin, when you were launching your virtual clinical experience early in 2021? What were some of the roadblocks you experienced, and how did you overcome them?
Well, I think every each month is different. And again, it's for the first thing, it was really finding a suitable time when you have people joining in from Eastern Europe, from South America, from Asia, and that's just a logistical administrative thing. The other component, of course, which you really start to see is sort of some of the disparities that certainly occur across the world, and the fact that people have internet, so they're able to at least log on is not a given, of course, everywhere in the world.
Right,
And
right.
one of the months, it arranged of things, but one of the months, one of the students was literally signing on sometimes in the dark, literally in the dark, off his car battery, because that's the power.
Mm,
That was the
wow.
power. Power was out at that point, and somehow he had internet, but I mean they had rolling blackouts, brownouts, and it was truly remarkable
Yeah.
what people, the fortitude, perseverance that we learn and see. We just take a lot of things, I think, for granted. But I think being flexible, people's schedule changed, being flexible with times and rolling with things, make up sessions. These are all logistical things that I was, I'm more than happy to arrange. But, I think all in all, we had already actually done a virtual curriculum during the pandemic for all the international students globally. Anyway, outside of AMO, one of our medical students had organized it. I had a bunch of material that I was happy to lend. So we were already kind of rolling as we were, putting this virtual clerkship together as well.
I love that story. It is literally, the story of every person in med school, the perseverance needed. Obviously, this is, just an extreme case with having to hook up to a car battery in the middle of the night. That is awesome, and
It was like
applauses.
the screen was dark, not because he had the screen off. It was
Yeah,
because it was dark.
literally
It
middle
was
of the night.
middle of the night.
Oh gosh.
His shadow his face, and but despite it all, he was so cheerful, happy, and just happy to be a part of it. It's really touching, really touching to kind of see him.
Yeah, the hunger to learn, right? That's really cool. And Dr. Goodman, what are some common challenges related to running a virtual experience? So you get it started. Now the day to days. Dr. Lin mentioned some kind of the timings, being flexible, that kind of thing. But what are some additional challenges that you've run into?
Um, I think it's the need, as Dr. Lin said, the need for flexibility on both ends. I think that as a student, I seem to remember. I mean, it's when the dinosaurs roamed the world a long time ago. But I do remember that we would sometimes show up for a lecture, and the teacher wouldn't show up. Why? Because they were in the operating room, with an emergency. So the students have to understand that. So what I do is I found that setting up a WhatsApp group is very helpful, because then in real time you can sort of say, look guys, the case is running late or running long, let's move the time around. And the students, to their great credit, are very patient with me. So sometimes I say, look, an emergency, let's push it back 2 hours. And then sometimes we'll do 45 minutes, and then I have to go back to the OR. So I said, look, take a break, or look at this, answer these questions and get the questions back to me when we come back in half an hour. So flexibility is very helpful. I think a WhatsApp group is useful, although, for instance, if you've got students from China, you know, WhatsApp's not legal in China. That can add a little bit of a challenge. But I find that communicating in real time is very helpful with WhatsApp, and you know, it's good also just to share things like, here's an interesting paper, you know, we're going to talk about it tomorrow, and then you just share it. And I think the other thing is, as Sam said, it's rotating. If you got big time differences, rotating and sharing the pain, so that, you know, one day somebody is sort of you know, logging in late at night, and then the next next day that person sort of you know, might get to log in, you know, at a decent hour early evening, but it means that some normal because, you know, they're in California as against in Japan. So you know, I think you got to be sort of if you're dealing with lots of time zones, you got to be sort of even-handed and rotate the time, so that it's not always easy for one person and always in the middle of the night, or always at 6 in the morning for somebody else.
Yeah. That's awesome. I like that sharing the load, share the burden, wake up early one day, stay up late the next. Kind of nice. So tell us some of the skills and competencies needed by preceptors. So those attending physicians that are saying, "Hey, this is something I'm looking for, you know, to opening up my practice to, but am I, you know, can I do it?" What would you say to the individual who's like, kind of on the fence about this?
um I think you've got to be you got to transmit the enthusiasm, you know, sort of on the screen. I also think that it helps very much to make things students focused or centered and interactive. I think that, I mean, obviously this goes for all teaching anyway, but I think particularly online, you know, particularly if there are lots of distractions, etc., involve the students at all times. I mean, don't just drone on and give a PowerPoint and then maybe ask a couple of questions at the end, but you know, sort of use question and answers. Use a lot of visuals. If you're showing a video, let's say of a surgical procedure, stop, ask a question, stop, ask a question. And you know, that way the students feel part of it. Get them to, you know, prepare little presentations for themselves, get them to present little case scenarios as if they're on ward, you know, bedside rounds, but make it as interactive as possible, so that they're not sort of zoning out. And I can just see from my own 15-year-old who's for the most part was at home online for his education for the last year. It's so easy to get distracted online that if the students want to get as much out of it as possible, they need to be engaged, you know, every minute of the session.
That is hugely helpful. Dr. Lin, anything to add there?
Yeah, sure. You know, as it was being set up, you know, one thing that came to mind was certainly, I think every hospital, every medical school is going to have its own policy on privacy, and so with these virtual visits, just being careful about, you know, if you are going to, if that's how your rotation's set up and you're going to the clinic or, you know, operating room or something, that patients, you know, either know about this or know who this person is on screen. From my standpoint, none of it is, as you know, none of it is patient-based. They've sort of very early on did not want any, certainly of this telehealth, these visits or rotations being either U.S. or internationally based with people that didn't know who these, you know, who the students were. So that's how my rotation is sort of based. But that's just sort of one thing to be careful, I think, about.
Yeah. So how do you navigate those conversations with patients who do feel uncomfortable with a virtual visitor or student joining the exam or the appointment?
Well, I think what Sam's saying, he doesn't, and neither do I. I think the hospital is so protective of confidential patient data right? It sounds like his joint and my joint, they don't go for it, and
Gotcha.
we just use these as didactic sessions. But I can tell you that you can take, for instance, CAT scans and X-rays, and you can anonymize them. You cut out the name, etc., and you can show a lot of the clinical material that you are using, to evaluate patients in an anonymous fashion, so that they're still seeing the stuff. They just obviously it's in a safe, anonymous way.
Absolutely, and I say that and that's really to the preceptors, not to the students.
Yes.
From the student perspective, obviously, a lot of this information is just brand new. So, it doesn't matter if there's a name or a person. It's really the pathology, and with the level of the quality of presentations of videos these days that have been consented from the patients. They're all readily available that we use, and the learning experience is all there. It's even more rich and condensed and compacted, as Elliot was saying, and so it's perfectly fine, and it's just primarily only based for that preceptor sort of view to make sure that everything's done, of course, appropriately.
Very cool. And for those that are joining us again on Facebook and Zoom, if you are interested in learning a little bit more about Dr. Lin and Dr. Goodman's programs, Antoine, if you don't mind, including in the comments, just links to their programs, just so that you can see a little bit more how Dr. Lin and Goodman have set up their programs, what they list, the experiences that students get to participate in, that kind of thing. Dr. Lin, Dr. Goodman, we'll start with you, Dr. Lin. During a virtual experience, as you mentioned, you're able to interact with students from all over the world. Are you able to get a sense for their competencies, and their skill set and their knowledge base?
Yeah. So again, everything is sort of individualized. We've got daily reading material schedule, quizzes, daily quizzes. So objectively, we actually have some data around that. Certainly, if you read the material, you can answer the questions type of thing. But along with that, aside from that, interacting with people and students face to face and talking with them, I do think you do get a good sense of a knowledge base and certainly who's been reading and levels of amount of time that people are putting in, for sure. But again, they're students, and we just want to have them learn. It's a really, I think I try to make it as, I think we all try to make it as, a friendly environment that people enjoy and take away from the month and learn something.
Dr. Goodman, anything to add there?
Yeah, I would say a couple of things. I think if you look at the sort of ways in which a student can impress a preceptor, enthusiasm, demeanor, showing up on time, breadth and depth of knowledge, the ability to think on their feet when asked a difficult question, powers of analysis, and the stuff like dexterity and sort of hands-on skills. That's a very minor thing of a surgical rotation at the student level. And the truth is, the sort of stuff that students do with their hands that's in the operating room, it's right at the end of the case. The surgeon has left, and the resident takes the student through how to close the skin and put a few sutures in, or how to put in a catheter in the bladder, or put down a nasogastric tube into the stomach. They're doing pretty mundane things that and it's not with the preceptor. So, the fact that this is virtual doesn't really detract from the opportunity for the student to impress the preceptor directly, because that sort of stuff, hands-on, they never do in front of a preceptor. But by the end of 4 weeks, you've had so much face-to-face, even it's virtual face-to-face with the preceptors, that the preceptors probably get as much opportunity, if not more, than in real life, as it were, in terms of, does the student know what they're talking about? Do they show up on the time? Do they look sort of together? Do they think on their feet? By the end of the rotation, you can get a very good idea of who's good, who's not so good. Does this person deserve like an A grade letter of reference, or do they deserve a C minus? So, you'll have students will have a great opportunity to really impress somebody by the end of the 4-week virtual rotation.
Thank you. And this is the last question from me. How important is it for hospitals and individual preceptors to consider hosting a virtual clinical experience? So, say a preceptor's watching and they're still on the fence about this virtual thing. How important is it? Dr. Lin, we'll start with you.
Well, I would sort of think about it from different ways. For at least for our field in plastic surgery, not every hospital, not every institution has a residency program in plastic surgery, and for those students who are interested in rotating away, thinking about having a rotation or virtual rotation that is available is, I think a plus. Certainly it is investment of time, energy, effort. I think that preceptors would have to think about if they wanted to host it. And I think you've got to really make sure you do it right in the end. These are real people, obviously, real students. They're spending their own hard-earned money, even though they may not be traveling and so on and so forth. It's a lot different, but it's still they're showing up for their experience. So I think you really got to make sure you're willing to invest the time.
Dr. Goodman, anything to add?
I would agree 100%. I mean, time is a value. Students' time is value. Money obviously is a consideration. So I think you've got to carve out time, effort, and energy to do this if you want to be a preceptor. And we already mentioned flexibility, and it is difficult to commit to a particular time in the day, but I think you have to, by the end of the 4 weeks, really have covered everything that you would want to cover, so that the student really feels that they've got or they've had the opportunity to develop a good working knowledge of your of that particular field of medicine by the end of it. And I think, why do it? I think that by the time you've been in practice for whatever it is, 10, 15, 20, 30 years, burnout is definitely something that is quite common. And I think that teaching and interacting with students who are passionate about becoming a doctor, and perhaps are passionate about your particular field of expertise, it reminds you of why students continue to want to enter medical school, want to enter residency, want to become physicians. And it might remind you of why you did it 10, 15, 20 years ago. And I think that is it can be an invigorating experience. And so I think, if you're prone to burnout, and COVID obviously has accelerated that, interacting with young people who remind you of why they want to go into it and why you went into it, it's a good thing, and I think makes you slightly less jaded.
Yeah, and that never gets old. Really, as Dr. Goodman said, it's really great to see that the next generation, and we all, at some level, go into medicine as a lifestyle because we want to help and teach. And helping means a lot of things. Helping directly, helping people learn, directly teaching people. It means a lot of things.
Well, Dr. Lin, Dr. Goodwin, Antoine, and all two are joining us. Thank you so much for taking the time to discuss this important topic of virtual rotations, and how to successfully launch and sustain these experiences. As mentioned earlier in the panel, look for those program links for both Dr. Goodman, who's out in New York City, the Big Apple, and Dr. Lin, who's out in Boston. Their rotations are some of our most highly sought after, most popular, and most beloved. If you're a U.S. physician interested in hosting a clinical experience through AMO, or if you are a medical student or graduate looking for clinical experience, you can head to our website, amopportunities.com. That's amopportunities.org. Both will lead you to the same place. And learn more or schedule an appointment. AMO members are standing by and ready to answer your questions. So, Dr. Lin, Dr. Goodwin, Antoine, thank you so much again for joining us. And we look forward to you participating in many more future physician panels.
Our
Pleasure.
pleasure.
Thanks so much.
You got it.
Have a
Thank
great
you.
weekend, everybody.
Stay
You
safe.
too.
Okay.
Thanks.
Bye-bye.
Bye-bye.